For now, we're going to start our second panel, Early Childhood Education Policy Design, Evidence from the Literature. I'm Jessica Brown. I'm an assistant professor of economics at the University of South Carolina and a policy fellow here at SIEPR. And I'm delighted to have with me three esteemed researchers. So first, Harris Eppsteiner is the Associate Director of Economic Analysis at the Yale Budget Lab and a former research economist for President Obama's Council for Economic Advisors. At the Yale Budget Lab, he has been spearheading the Yale Budget Lab's model of early childhood education and care, which is an effort to model the economic effects of child-focused policies on families, children, and the government in both the short and long run. So I'm excited to hear more about that as we continue with our panel. And then next we have Dr. Lynn Karoly. She's a senior economist at RAND and a professor of policy analysis at the RAND School of Public Policy. Much of her recent research focuses on early childhood education, including research on care use quality and educator compensation. She's also recently worked closely with Vermont on their policy rollout that you heard about earlier. And then finally, we have Dr. Aaron Sojourner. He's a senior economist and deputy director of research at the W.E. Upjohn Institute for Employment Research. And he's also a former senior economist for President Obama's CEA. He's also currently, since 2019, a member of the Minnesota State Advising Council on Early Childhood Care and Education. And he has an extensive research background on early childhood care and the market. So I'm looking forward to our panel.
Okay, for the first question for the panel, so each of you, as I mentioned, has experience working directly with policymakers. And I was hoping you could share one example of how you've translated research for policymakers, and maybe share one lesson that you learned from that experience. Start with you guys.
Yeah, sure. First off, just want to say thank you again to the organizers. This has been an incredible day so far, and it's really been great to meet folks here who are working at the forefront of efforts to increase access to affordable and high-quality early childhood education and care. As Jessica mentioned, we at the Budget Lab, we're a nonpartisan group of economists who study the impact of economic policies on American families and the federal budget. We've been working a lot on this issue in recent months. We actually just released our first report on the topic this morning, coincidentally. If folks are interested, you can go to our website, budgetlab.yale.edu, to check that out. I promise, not just a shameless plug, I am going to answer your question. It is relevant. So in that report, we, like Jessica was saying, we build a model of early childhood education and care that includes both the supply and the demand side to capture a lot of the dynamics that folks here in the room have been talking about today. We were sharing some early results that we got out of this model with some stakeholders. They were policy advocates who were working on this issue in a particular state. And when we kind of previewed our results, our model looks at things you might expect to look at, things like changes in care enrollment, cost burdens borne by families, and then effects on the federal budget. We also look at effects on care workers. One of the things that I'm most excited about in our model is that we look at long-run economic changes for children. So we look at what's the effect on their earnings years and decades into the future. And these advocates who were interested in making the case for these policies in their state asked us, well, that's great. How many of those kids are going to live in our state? And we said, we didn't really think about that. The other question that they asked us is, well, what does your model say about fraud? And I don't think that they were sensitive to the fact that this is an ongoing topic of arguably bad faith discussion, but I think also they had a very good faith desire to try to design policies that are most effective in terms of program integrity. And we, unfortunately, weren't able to really speak to that. The lesson I take from that is that, I think as researchers, we tend to extract away a lot from the institutional contexts that folks who are actually on the ground making these policy decisions are making. I think of policymakers. Policymakers are constantly making choices under incomplete information. And as researchers, we have the luxury of saying, well, I can't really speak to that question, so I'm just not going to say anything. Policymakers don't have that luxury. They actually do need to go out and make decisions. And so I think as researchers think about how to translate their findings to what is most relevant for policymakers, they need to be hyper aware of what are the actual, what are the conditions on the ground, but also what are the criteria by which policymakers are thinking about program design, because those might not actually be the same that researchers might jump to at first glance.
All right, excellent example. So I was going to use the case of the work that we did in Vermont, which you've heard a little bit about in terms of their policy and the direction that they went. So I was part of a team at RAND that, interestingly enough, the cost and financing study that was done was mandated by the legislature. So there was a bill that had been passed requesting a study that was then sort of monitored by their Joint Fiscal Office, which in Vermont is the equivalent of a legislative analyst's office. They put out an RFP, so it was a competitive process that we eventually won. And the great thing, though, I think about the project was that, first of all, this was a decision that needed to be made. The legislature was ready to act, the governor was ready to act. So there was a sense of momentum and a need to get the answers. And to also do it in a shorter time frame than often I like to work. Accessing data that didn't always come, when we wanted it. But then the interaction with the policy folks was key. And one example would be that one of our goals with the study, after we figured out the costs of the system that they had in mind, some of which was specified in the legislation, they wanted to know what revenue streams might meet the cost needs. We gave a number as to what the system would cost. What were the options for revenue streams? And there we didn't just go out and say, well, you can start on a list and think about all the ways in which you can raise tax revenue or other strategies, but really worked closely with the decision makers about what were feasible options, what options were already on the table that the governor and legislators would consider. And that meant it really did narrow our options. An example, Vermont already has one of the highest sales tax rates among states. So we decided, okay, increasing the sales tax by a given percentage was not really a viable option. So we left that off the table, didn't even consider it. On the other hand, you heard that in the end, an additional or essentially adding on a payroll tax was not something that the state already did. So it was, and was on the table either for child care or other possibilities. So it was one that we, in the end, did look at. And the other thing I think that we realized was, much of these systems now, in order to make them work, it's going to require more money. And often there's not a single source that will get you there. There's no magic pot of money that's sitting out there to tap. And so we also looked at combinations of taxes from different sources. And it gave the legislature a sense of how much room they had, here's the gap we want to fill, where do we start, and as we add these pieces together, can we get there? So I think that interactive process was really useful in the context where they were close to making a decision and wanted these numbers to support them in what they did.
I'm going to share first my lesson and then my experience. My lesson is to focus your energy and your time on people who really care about achieving real outcomes for people in the world. And don't focus your attention on people who aren't, people who are ideologically driven, people who are, going after a very narrow payoff for a very, for some very narrow interest group that they care about. Because I'm never going to be that good at the ideology. Like, I'm never going to be that good at engineering payoffs for this little group. But I am going to be good as a researcher, as an economist, and not me, but the whole community is good at, our comparative advantage is trying to understand what the effects are going to be. If our community is here and we want to get to there, promised land's over there, like there's a map. We can go this route or we can go that route. And what are the trade-offs between those routes? If we're looking for policy options to get, you define the objectives, and we're going to be able to tell you about the trade-offs of different approaches. I worked, as Jessica mentioned, in the Obama administration with Mario and Harris, and then on January 20th, they all left me in 2017, and I was still there, and a new administration started, and most of the people in the new administration hadn't worked in the White House, didn't know what the Council of Economic Advisors was, but I heard that Ivanka Trump was very interested in child care and paid family leave. So I just started, I looked through the White House directory and, just started emailing her and emailing all her staff and, trying to explain what the CEA was and, trying to find the person who did care about actually these issues and making things happen. And, they came in with campaign promises which were like supercharged tax advantage savings account for care and paid leave for birth moms only. And we were able to actually find people there who were interested in a broader set of issues. They weren't that committed to those particular solutions, and got them through a process to endorse the idea of let's boost CCDBG funding substantially, and let's do paid family leave for 6 weeks for all new parents. Okay, and that made it into the President Trump's first budget. That was no prior president had proposed 6 weeks of paid parental leave in a budget. I mean, it didn't go anywhere. But the CCDBG funding did go up substantially, and that was not something they had on their radar coming in. And the way we did it was basically being serious about trying to understand what their goals were, trying to find the people who actually cared about the world, making things happen in the world, and then trying to make the case, help them understand, if you want to get there, here's one way, here's another way. Sure, that's something you talked about before, but there's all these downsides to that relative to this approach, which maybe is going to get you where you want to go in a credible way. And so that's...
Yeah, wonderful. Well, thank you all so much for sharing your experiences. Oh, there we go. My mic is working. And so I wanted to hear more, since this panel is about the evidence from the literature, and you have a lot of policymakers in the room. What do you think is important evidence in the literature that can either motivate intervention in this space or guide the implementation of any interventions? And maybe we'll start with Lynn.
Sure. Well, I think the literature has evolved in ways to support the field, the direction it's going, and implementation. So when I first started working in this field close to 3 decades ago, much of the focus was on access. Who was accessing various kinds of early opportunities, whether it was early intervention, child care, pre-K. And once we started to get a handle on the access issues, the next dimension was quality. We don't want kids just to be in programs, to be in settings, but we want them to be in settings that are going to support them developmentally. And we went into an era of trying to understand quality. What does it mean? How do we measure it? How do we incentivize it? And that came up earlier in the discussion. To me, sort of the next issue that got attention was the workforce, that we really were undercompensating the workforce, and the workforce was a key component of quality. So that was sort of the next logical stepping stone. And we started collecting data about the workforce, trying to understand what they were compensated, what their working conditions were like, how were they supported professionally. And again, I think that helped undergird what we have been doing recently with respect to the workforce. And then the sort of last domain, as I've seen this field evolve, is questions about cost and financing. And that's really where we are now. I think it was evident way back when that the system was underfunded for what we wanted to accomplish, but that really came to the forefront once we understood, who's not getting access, that we don't have the resources to deliver quality, we're not supporting the workforce as a key part of quality, and so on. And each step along the way, I think our field has garnered resources to support research, and we can talk to policymakers on each of those fronts in ways that can support our understanding of the current system, but also how to bring it forward on any of those dimensions.
Aaron? Hi.
I think making the case that early experiences really matter and shape the future of our children and our communities, and I think there's a lot of evidence there. I think everybody here is familiar with it. You don't need me to rehash it, but that's an important way that the literature, I think, guides policy. Is just like there's a huge investment shortage in early childhood. We spend, once kids hit age 5, we multiply our per child per year investment times 9, and it's crazy. For 13 years, that's the right amount of, that's a decent amount of investment, but for the first 5 years, we leave parents and families like hanging out in the wind by themselves, and they don't have resources. The public's making the problem worse by not putting in resources. It's crazy. Of course, there's a crisis for workforce, for families, for businesses. What else could we possibly expect except a crisis? If there's no private resources, there's no public resources. But then at 5, we're like, oh, times 9. Cool. And then the gaps stop widening, and there's buildings, and there's staff, and every American has the right to send their kid to a trusted organization in their community that can. That's a rant. Okay, I'll just stop there. I was going to talk about quality, but I got distracted.
So I can talk a little bit about what we found in our report. We at the Budget Lab are engaged in this process of, Sarah in the last panel talked about researchers looking at what is, or really what has been, and we're in the process of translating that into thinking about what can be. In our report, I think the biggest conclusion that we come out, and I'll just speak more to questions of broad scale policy and program design. The way I tend to frame it is, when you're designing these sorts of supports for early childhood education and care, you need to think carefully about what your goals are. And the reason is because you can see this in our findings in the report. Of the following things, you can really only choose, the following 3 things, you can only choose 2. One is low out-of-pocket costs for families, for parents of young children. 2 are high wages for workers in the care workforce. And the 3rd is low fiscal costs to the government and ultimately to society in the form of higher taxes or borrowing costs. So you can really only have 2 of those things. If you want to have low out-of-pocket costs to families, but a low impact on the budget, you do need to sort of underpay providers. Flip side of that is if you want to pay providers a lot but also have a low fiscal cost, you are going to be leaving families bearing more of the cost. So really, the thing I think to think about is when in designing these programs is who's ultimately going to bear the cost of the provision of this care. Is it going to be parents? Is it going to be providers and the workers that they employ? Or is it going to be the government and ultimately society as a whole in the form, or some portion of society in the form of taxes or borrowing costs?
So I'm going to follow up on that one a little bit. So you all spoke somewhat broadly about the literature. and broadly what we found. And I'm wondering if you have maybe one particular research finding, maybe more of something more recent or anything that you think is particularly useful in this conversation that you think policymakers should know about. And whoever has thought of one first can go first. Yes, go ahead.
I'll jump in. So we did a study looking at Minnesota, looking at what happened when the state increased its CCDF voucher funding. And what we found was that the market did respond, that, more providers entered, less providers exited. We were able to, Minnesota has really good data on prices, so we could actually look at how much quantities of licensed capacity changed, and we could look at how much did prices change. And, if you think about a supply curve for care services, when you increase subsidies, what you want to happen is for more kids to have access. So you want kind of a flat supply curve. You want the movement to be like more quantity and not a lot more price. But if the supply curve's like really, really steep, then you're going to get just a little bit of change in quantity and a lot of change in price, a lot of increase in price. And it's kind of an open question, like how steep is that on average? And what we found was that quantity increased in percentage terms 10 times, 11 times more than price did. So we see a pretty elastic supply. We see that consumer demand subsidies can drive change, at least in this one context. So I know a lot of people are skeptical about that, but I'm here to report from Minnesota that we found that there is some responsiveness there. And we've only looked there at this one policy change, but we have more in the works.
I'll give another example. So, one of the questions is kind of, if you build it, will they come? So if you create a system that increases the subsidies to families, are they going to make the choices that you're trying to incentivize them to make? And I think one of the things we all know in this field is family decisions are very complex. We talked a little bit about, do families value quality or dimensions of quality in the same way? They may be making choices not only about their infant, but their toddler, and thinking about where am I going to send two children in this age range? And when I make the transition of the older one into a public school, what I do with the younger one, do I want to bring them along? So, and those are issues we don't often get to observe, and our data don't always tell us about. So my quick example is a study we did for Oklahoma as part of one of the regional education labs. They have universal pre-K, but we wanted to know, well, who was attending universal pre-K? Was it really universal? And it turns out in Oklahoma, they get close to 80% of 4-year-olds, or the year before they'd enter kindergarten, in their public education system, which really doesn't have mixed delivery in the same way that many other states. And from what we could see, families were making these choices like, I need a longer day of care. Mm-hmm. So what the public school is doing with 6 hours a day doesn't work for me, right? And so they're having to opt out of, a free system in order to make their child care needs, to meet their needs. And similar questions about Head Start interacting with the public education system. So it's really important, New Mexico, I know this is a focus for them, is we've got to study what happens when we make these changes, because, there's law of unintended consequences. There's ways in which families are going to make choices that may not always map into our, mental models or even our economic models. And so it's critical that we're really capturing the outcomes so that we can then figure out, maybe that didn't work the way we thought. What are we going to do to modify it?
I'll just very quickly shout out a team of researchers, a different team of researchers at Yale, who've been very involved in the city's expansion of universal pre-K over the last few years. They have, I think, a working paper out already that looks at the introduction of the program and looks at what the effects are for families and for children in New Haven. I really like this paper because they were very involved. As researchers, I think it's a really interesting model of partnership with policymakers in the implementation, such that evaluation of the program was actually built in from the start. I think we used their results in our paper for their effects on kindergarten readiness and effects on test scores in early elementary school, which are very meaningful, especially for children who transition from more informal forms of care into pre-K. I'm curious to see, this is my understanding is that this is an ongoing partnership. I'm curious to know what the longer run effects are. And I know that they're also very interested in the fiscal effects for the city. So if for folks who are working in localities that are considering these sorts of programs, I highly recommend checking that out.
Great. So I was wondering where you see the clearest opportunities for researchers to be involved with policymakers, and how can researchers be a resource to policymakers? Go back to you again, Harris.
Yeah, sure. Yeah, happy to. So I mentioned this before, but I think that this requires a little bit of somewhat sometimes uncomfortable meeting of the minds on the part of policymakers and researchers. Researchers need to be able to tailor the research to provide information that is of direct use to policymakers in the design and implementation of programs. Policymakers, I think, sometimes need to, should be aware that researchers are not necessarily always going to have the answers to those questions, and I urge them to be patient with us while we figure that out. I think the biggest opportunities come actually exactly from these sorts of partnerships that I was just talking about, where I think we heard earlier today about the experience from New Mexico, where this wasn't a one-shot implementation. It was a gradual change in eligibility criteria over years. I think that's one example of a case where ongoing evaluation on the part of researchers can help inform the next stage of the program. And so having those partnerships in place at the start of these kinds of expansions of investments in early childhood education and care can help set up success, not just in terms of helping the researchers find answers to questions that we've been wondering about for a long time, but also helping policymakers think about what changes or tweaks need to be made in terms of either broad-scale program design or on-the-ground granular implementation.
Oh my God.
Loud.
Okay, on that note, so I was just going to point out that I think, one of the things we'd like to see, especially as economists, is that we're able to use our knowledge and data to model what systems look like now and what they can look like in the future. And you've heard today, if any of you were here for the earlier session, about a new model coming out of Stanford Institute here, Jessica and others, as well as the kind of work the Budget Lab is doing. And I think, we've built our sophistication to match the fact that the field is really trying to push this area to do more, and to really kind of anticipate what we might see. I do think it's important to recognize that there are some limitations in what we have access to, the knowledge and information, the data, and we try to do our best to point what those—
An understatement.
Yeah, to point out what those limitations are. But I think where the field can benefit is, back in the 1970s, there was research done on the child care sector that we had access to the data. I think somebody mentioned the cost, quality, and outcome study.
Yeah.
And that study supported research on what economists call elasticities, which helps us understand how people are going to respond, how families are going to respond as the prices of care change, how the child care workforce is going to respond, and as their wages might change, providers respond. And it turns out we haven't been doing much of that research with more recent data. So I'm guessing that, behind the model that we heard today, some of those old elasticities are still floating around. Maybe they're good enough, But, you know, it would be really nice. But that also means investing in the kind of data that let us know a lot about families, the choices they were making, what the supply options were, you know, what their choice set was. And we just haven't invested in that kind of data in ways that support that research. Likewise, I'd say, you know, a lot of the action now policy-wise is at the state and local level, which is great. You know, at the federal level, not much is happening. And at the same time, most of our data sources are collected nationally and aren't really meant to be used, even though they might have state identifiers, used at a state level in terms of being representative data and so on. So that's just another limitation, especially if you're talking, I mean, it's great, some of our smallest states are making these investments, but they're also the ones that are, you know, a few hundred cases in the national data set. So
can I just jump in to add something there? You know, Jessica and I were talking about this earlier, that the nationally representative survey that we use in our model, and that a lot of other folks, Aaron and co-authors have used in the past, it's collected every 5 years, and it's nationally representative. It is not necessarily representative at the state level for small states, like Lynn was saying. So our model, for example, uses a baseline data set from before COVID, which we all know changed folks' preferences around childcare and work in ways that I think we're only now really coming to fully understand. States have a lot of data already at their disposal, administrative data, programmatic data, things like that. It is usually not in a form that researchers are able to make use of, and it's usually not in a form that is standardized across states. I think there's enormous opportunity for states and localities to form consortia to try to pool this kind of data in a standardized way and make it available to researchers. I come from a background of labor economics, and the Census Bureau actually does something like this with the wage records that are collected by states in the implementation of unemployment insurance, where they kind of hoover up the data from the states, standardize it, and make it available to researchers. Having something, you know, even 1/10 as large as that for programmatic data on early childhood programs would be of enormous use. It is also very expensive, and you know, in a world of scarce resources, I do take the argument you probably want to spend the first dollar on the kid and not the data about the kid, but that is just something for folks to think about at the state and local level. Sorry, John.
Yeah, I mean, I think the question is where are the clearest opportunities for researchers to contribute? I think there's like two key periods where that collaboration can be most fruitful. One is like after the policymakers have a good vision for what what their goals are and what like their priority populations and outcomes, like what are, and I know it's a messy iterative process, and I know this is a little bit stylized, but like what I'm saying is don't come to us to find out like what you should care about. Like you're expert in, you know, elected officials talk to their people, they like know the communities, right? They're experts in what the community wants and needs. If you have a good sense of what you are trying to achieve, and you have a good sense of what the political constraints are and the legal constraints and the fiscal constraints, because again, like maybe we know that stuff, but probably your team knows that better than we do. But once you have some expertise in those things, and you're like, okay, we want to go there, like then come like, and we have maybe some leading ideas. We're thinking about this approach and maybe this approach. Then come, like researchers have productive things to contribute at that time. and they're, because we have maybe perspective from other parts of the country, we have perspective from theoretical model, like, and empirical evidence that's more systematic maybe than you know, and abstract, but like we can help think through what might happen, what are the unanticipated consequences, what are the mechanisms, like, and we can also help predict maybe in a, like these models do, like you want to try something new that's never been tried before, that's not something you can go to the old data to find out. That's something you need a model to predict out forward. and you need theory for that. And we have that. So the second thing, the time when I think researchers can be most helpful is like, if you have a program that's up and running and you really believe in it, like, and you want to validate it and you want to show funders, potential funders, voters, or philanthropy or whatever, like this is having good benefits in the world, you can come, researchers are there to help, like, be outside evaluators and to say, we're an independent voice and we know how to beat this thing up. And the risk is that we're going to find it doesn't work, and you have to be willing to accept that risk. And we're not going to work with you if you say you can only publish the results if they are the way you want them to be. But if you believe in it and you think you're willing to bet on it, like, then researchers are ready to collaborate. And it's a lot of free labor and a lot of free expertise, or maybe costly, but still, like, at a good rate. And then also, I guess, continuous improvement. Like, if you have things that are going and you want to build feedback loops and you want to build, like, monitoring and you want to build intentional variation to see, like, oh, if we move in this direction, is that better or worse? If we move in that direction, is that better or worse? Like, we can help with those kind of things.
Great. Well, so I think we have a pretty good body of evidence in early childhood research, especially to motivate these kinds of investments. We've touched on this a little bit with the last question, but I'm wondering what you think are the most important gaps in the literature and how researchers and maybe policymakers can work to fill those gaps. Back to you again, Aaron.
Okay. I really think the biggest gap in everyone's knowledge right now that's, like, really a huge problem is quality and quality assurance. Like, access is a huge problem, but it's a resource problem. Like, and there's better and worse, more efficient, like, different ways to do it. But, like, it's not a mystery how to expand access. It's not easy to get the political will to do it, but there's not, like, a huge amount of scientific mystery about it. There is mystery about quality, and, like, we're used to using very coarse measures of quality in all of our policy, and, you know, centers versus home-based versus FFN, class, QRIS 5-4, like, it's very coarse. We're going to come in and do an inspection once every 2 years for a day, like, never mind the other 728 days or whatever. Like, being able to measure quality at scale, reliably, accurately, meaningfully, in a way that's meaningful to parents and meaningful to neighbors is a huge challenge. And, like, that is, I think there's things that we can do as a researcher and practitioner community to make progress on that, but there's a lot of tough data governance challenges that need to be addressed to, like, make that happen. But it really is a bold new world in terms of our ability to analyze data and to analyze a lot of rich information about kids' experiences. So I think there's a lot of possibilities ahead. And I think it's critical because, like, a lot of families are scared to send their kids to care because they don't have quality assurance. Like, by definition, you can't see what's happening when your kids are in care, unless there's maybe a camera, and you have a little app. Like, okay, I have more rants, but I'll stop.
Well, I wanted to follow up on that because, what concrete step do you wish policymakers maybe would take to try to rectify that?
So, okay, so one thing that I would be willing to, I don't have great evidence for this, but I think that, like, if you think about what high quality care is, it's responsive attention from a trusted adult. And that means responsive attention means low child staff ratios and other things, but like that's a necessary condition. And trusted adult means low turnover. So like, let's pay for those things. Like, let's bet on, I would bet on those things. It means transparency and credibility to parents. So maybe we should pay if they have a camera system in the classroom that parents can see what's happening when they're away. Maybe that's a type of quality. Maybe that's a signal of quality that is worthy of support. Maybe that there's ways to analyze that data and to test kids, before and after, or to measure how much they're laughing, measure how much they're singing. Like whatever the thing you think matters, like measure it. Measure it and see how much variation there is in it across providers and reward it. And then there's also like tricky things like if you have a centralized referral system, if there's families that are equidistant from a provider, like build in some randomization to it and then track kindergarten test entry scores or track some outcomes that you care about later. And now you have a little experiment that tells you about, these sets of kids are the same before when they showed up to get referred, but, one got a coin flip to that provider, one got a coin flip to that provider. Now, how much are they laughing when they're 5, So there's things you can do, but they require some administrative and data challenges.
It's just about time to move to Q&A, but Harris or Lynn, did you have anything you wanted to add on gaps in the literature, anything burning?
One thing I'll just say is, I think we're always very interested in what the long run outcomes are of a lot of these programs. Definitionally, that's hard to know in the first couple of years of implementation. But this is another plug I'll make for involving researchers early on in the process. You can set up systems now that will allow us 10, 15, 20 years in the future to try to understand what the impacts of these programs are beyond just the short run. And that's a really important question, not just for program design, but also for thinking about the costs and benefits to society as a whole of these programs.
100% agree. So, questions?
While we're getting the mics around, just do one last lightning round. If each of you could tell me one policy that you wish policymakers would implement or consider implementing, just tell me what the policy is.
I already did mine.
Yes, Aaron wants to pay for low turnover and low ratios.
I would streamline funding. And even if you can't do it completely, do it from the perspective of parents and providers. Parents should see one system. Providers should see one system, and behind the curtain you can do whatever you want with where the money is coming from, but we've got to streamline the system.
So the Budget Lab at Yale, as a principal, does not endorse or oppose any particular policy. What I will say, though, and what I would love for folks to think more about in the early stages of designing these programs is what is your funding mechanism, and what, in particular, is the progressivity of that funding mechanism. A lot of programs in their initial design, and eventually they may move off this, but like I've seen proposals that where a good portion of the progressivity of policies is undone by having regressive funding mechanisms. So, for example, this is not to like throw shade on any particular state's decision here. These are complicated decisions that often involve political choices that are made. But like, for example, like a payroll tax is more regressive than a broad income tax. And so there may be other reasons why you want to do a payroll tax, more of a pay-in system depending on the program. But moving from a broad income tax to a payroll tax, that will tend to reduce the overall progressivity of your program. So I just very strongly urge folks to have that in the back of their mind, because oftentimes we think about the program design and then we think about how to fund it as opposed to thinking about that as a whole.
I think we had a question. Okay, thanks.
Hi, Laura Pryor with the California Budget and Policy Center. Thanks so much for this great panel. And Harris, I was really interested in what you were saying about the utility of being able to access more state-level administrative data. And I'm curious, in all of your research, if you have examples of states where it has been easier to get that data, and just any additional detail on what you would suggest to states to make that easier.
I'll just say integrated data systems. I mean, that's sort of the buzzword, and the states are at different levels in terms of the extent to which you could link, cradle to career kinds of data, that you've got common identifiers that let you look at how, children's lives evolve and, maybe their families too. So it's complicated. Sometimes there's resources to help do that, not always. I know California has been hung up over the years because of things like, IDs and when they're assigned, and, can you continue them over multiple years? So it is an issue, but it certainly, some states have, started figuring it out.
One resource I think that is pretty good is the Coleridge Initiative, which is a state data, like secure data environment that, this is building off Harris's point about multi-state harmonization. So if you're interested in comparing your state with other states, and you're interested in having researchers, partnering with researchers to look at across states to understand, that's another thing. So integrated data within your state, huge, also across states.
Hi, I'm Haley Hines. I work with Secretary Gerginski and at New Mexico ECECD, and I'm wondering, so in the New Mexico system, we are thinking a lot about research and evaluation. We have sort of local partners and national partners helping us think about things like implementation evaluation and like looking at, what do we see happening with workforce compensation. So we have a number of these pieces in place, but I'm curious, well, I have you three, like if we think about sort of New Mexico being one of these kind of labs for the country, sort of it goes beyond our work, right? It goes to like what lessons do we learn from it for the country? What are some things you would want to make really sure we're measuring or setting up to measure that, like, so that 10 years from now when everybody's like, well, New Mexico did it work? That like, and we're thinking about this, but I'd love to hear your thinking about it.
So I think one thing that's really important that's often not preserved very well or documented very well is like the rules by which decisions are made about where the funding goes and how much funding goes to who. So not just how much did go, but why. Like, is there a formula? What's the formula? Is there a spreadsheet? Like, who was next on the list and didn't get funding? Who applied and was rejected? So all these kind of...
You should probably say why that's important.
Because those are good comparison groups. Yeah. So you can see like the effect of who got funded, you can see what happened to those people or those programs or those communities. But if you don't know who was really close to getting funded but didn't, they tell you like what would have happened, and you don't know what would have happened but for the funding. So that's one thing, is like program administration, like resource allocation rules. Another thing is like, is prices. I would be like price. I don't know if you, how New Mexico measures prices, if you do, but that's something that most states don't have good data on. As economists, we think that's really important. I'm happy to tell you why, but I'll spare you now. And then, yeah, like longitudinal connections to the kids, being able to follow the kids and the families' birth conditions, birth certificates, like integrate that, WIC, like all that.
Information from state health systems is also really important in thinking about the effects. Thinking about a little bit later in life, things like tracking kids, like educational attainment, employment, criminal justice involvement, use of social services, all of these things are actually really important for broad evaluation.
Child welfare.
Yeah, yes.
And I would just add, going back to the program you're implementing, is as much as you can measure what children and families are getting. So it's not just that children were enrolled in September in a program, but what did their attendance look like? What was the continuity? And in general, sort of the stability of children and families' experiences, particularly with populations that are highly mobile, and the connection. We're sort of talking about connections to other resources too. They're part of a larger system. What does that look like?
Great. Well, we are at time, so thank you all so much.
Thank you.
Thank you.
Thank you.